What do you think are the sort of the three key considerations for a biotech when designing a clinical trial?
So the most biotech trials are not the most simple ones. So they usually need adaptive designs. So flexible language in a protocol becomes very important so that they can adapt to it. But also allow for multiple circumstances to happen without needing a protocol amendment. But you need that to still comply with all the guidelines that are there. And this is possible, but again, an expert can help you put that in based on the current knowledge and standards in the industry.
And especially we know how costly protocol amendments can be, because it's not just updating
and time
the protocol,
consuming,
but the submissions, all the other documents have to follow and be updated as well. So that's really important.
And I also find it very important to keep a very close eye on the fact that the protocol is really clear, not just to the one making the design and writing the protocol. I really also emphasize when I work on creating designs, I emphasize on the clear and unambiguous wording in a protocol, but for all of the users. So the clinical trial sites, the nurses, the persons who will have to do data entry, but even when it translates into an informed consent form for patients. Patients also need to have everything clear and understand what their responsibilities are. Because they're an essential part.
What the trial participation would mean for them.
Exactly.
So what are the risks, what are the benefits, what are the procedures, and how much time it takes. So everything really has to be thought through.
Yeah, and so that they make an informed decision, because when a patient enters into a trial, you want them to complete. So you need to be upfront with their expectations and how they can contribute and what's expected from them.
Yes, and it's the investigators and the study nurses and coordinators who explain what the study entails.
Yeah, so it needs to be very clear. That's really important.
So clarity and ambiguity.
Yeah.
So that's the second thing, and the third?
So the third thing is actually the feasibility of the whole trial. Actually the whole design, you need to start thinking with the end in mind. And when you start a trial, you already also need to picture what comes after this trial. But the feasibility, meaning how doable is it, how much are we asking from sites, and you need to touch upon the balance between everything as a sponsor you want to know, but also what we're asking from patients and from sites to actually do to contribute to where we need to go. So this drives that to focus on what's really important for the trial and to distinguish between those things. And then you can also operationally work risk-based on the most important things. And that starts with a design.
Yeah, so it's kind of tying also to like what you actually want to achieve at the end of the trial. So, where you want to be in your clinical development progress when you receive the data from that clinical trial.
Yeah.
So what sort of, what kind of a stepping stone that is for you in the development of your asset.
Yeah, absolutely.